Welcome to another episode of Women in Focus. Today we are in good hands because we've got a medical doctor with us. Her name is Dr. Nadia Khan. A few weeks ago, I had an opportunity of talking to her on Gupshup, and I requested her to come and talk about her life and about this COVID thing that we're going through. So let's welcome her in our program. Nadia, you're most welcome. How are you doing?
Thank you so much. I'm very well, thank you. And it's a pleasure to be here on your studio to be interviewed by a legend in broadcasting. So thank you.
I love that. I never get tired of listening about. So COVID. I mean, that is the thing that everybody talks. Mm-hmm. How has it affected your life as a doctor?
You know, I think about those very early days when COVID first hit and we could see what was happening in Italy and what was happening in New York. And I have to say, I think as healthcare professionals, it was terrifying. And I'm sure it was as well for the public. But in those early days when we were watching what was happening and we didn't know how bad things could get in Canada and in particular in BC, it was probably the most terrifying professional time of my life.
Wow. Did you at that time feel that this is going to be here with us for a longer period of time?
No. I really did not anticipate how catastrophic it would be and how it would affect everyone around the world to this degree. And I certainly didn't think that it would be here so long.
I was, when this first came out, when we were reporting through our radio station, and I was thinking, when SARS had happened, it wasn't as big a deal as this one.
In Canada, true.
In Canada, huh? So what was so different about SARS and this? I'm going to be asking Dr. Bonnie Henry this question as well, but I would like to ask you too.
Well, I think, you know, the Canadian experience of SARS was more manageable, but I think the Asian experience of SARS was much more difficult. And I think that's why they were prepared for a massive pandemic. And so the issue with the COVID virus is that it's more infectious than SARS, and it's got a certain amount of lethality. So for example, if you compare to Ebola had a 50% mortality. So because it was so fatal, it didn't have a chance to spread. And this virus has that perfect storm of being quite infectious and also kills enough people that it's a problem, but it's still very infectious. So that's sort of the difference between why it spreads so wildly here in the Western Hemisphere and around the world compared to the SARS, which didn't have as much of an impact.
As a physician or as a doctor in this particular field, did you look at the European experience, the American experience, the Chinese experience, and then the Canadian experience?
Absolutely, and I think that's what the whole world was watching, this in slow motion happen in Asia, in Wuhan, and then in Milan, and then in New York. And then we saw, you know, what would it be like in British Columbia for us. And I think it wasn't as, at least the first wave wasn't as significant of an impact as it was, say, in Eastern Canada or in New York. And I think that there were some factors. I think we, in British Columbia, Dr. Henry and others had made very quick decisions on how we're managing nursing homes. And then also, I think our spring break was earlier ahead of the wave, whereas in Montreal and Toronto, their spring break, school spring break, they traveled to New York per se just before the infection. So their timing, I think, was not, they didn't have the benefit of the timing that we did by luck. So they
because we were so far apart as well.
Far apart, and plus we probably weren't traveling to locations that had a higher risk of COVID.
And you mentioned that since the last 1 year, life has changed for everybody. How different is it for you? Go back a year and tell me.
So I think, you know, again, in those early days, I had seen the first case that came into our hospital, And in those days, we were thinking, well, how should we manage this? Everything was very, very new, and we were very nervous about how we should respond. And we had medical students and residents and learners working with us. So, we held emergency meetings, and some of our education experts in our group had said, well, let's take the learners out of the equation. So let's try to minimize the number of people that would see each patient. So we quickly, on our own, I think, came up with very early strategies of how we would manage. And I think that's what you saw everywhere around the world.
Right.
And then they all ended up coming up with very similar strategies. But every week as this was rolling out, we kept thinking, well, what are we missing?
Yeah.
What's next? What's next? So, we ended up in a world where we're doing a lot more virtual care.
Right.
So for people that can be seen at a distance, we're seeing them at a distance, which is a really significant disruption on how everybody was managing their care. And I think that lack of human contact, we're sort of seeing the effects now on mental well-being and mental health issues. But so that was a significant change. But the stress level, I think, in the hospitals, especially in the early days, were very, very high.
Wow.
And I think now that, we're deep into getting past, I think, the second wave, that stress level has lessened. But I think the next wave that I think the whole world is experiencing is fatigue. And I think the issue of employee well-being is now the current issue, and mental health of the whole province and the public is now sort of one of the major issues, and then vaccines. So we've moved along the ways. And I think for a lot of physicians, especially who work in hospitals, the job is still in many ways still the same, but you have to work a lot more now because we obviously need to expand and be very mindful and with the full personal protective equipment and those kinds of changes, which I think everybody is now using personal protective equipment and the social distancing.
It's tiring to use that.
Absolutely, absolutely.
When we've passed the whole year and we don't know much about the virus still, what it does to our body, do you guys have an idea as to what are the long-term effects of this virus on our body?
That's a great question, and I think that's something that we're learning more and more about all the time. But what we're seeing, many of the general internal medicine groups across the province have what's called a COVID recovery clinic. So in this clinic, they are actually seeing this post-COVID syndrome.
Okay.
And the majority of people, they get COVID and they survive.
Yeah.
That's the majority of cases.
Yes.
And of course, there are risk factors for certain people, the elderly, people with diabetes, high blood pressure, obesity, heart disease, heart failure. Those kinds of conditions predispose people to getting COVID and having more serious COVID. But the majority of people survive. But we are seeing that people are getting this sort of after virus or post-viral syndrome where they're very fatigued and short of breath, for example, after this, and it's actually staying for longer periods of time, weeks, sometimes months. So we're sort of seeing, and other issues are cropping up, like people are developing blood clots, for example. So we're seeing these kinds of conditions that are happening post-viral infection. And after viral infections, you can get these kinds of symptoms, but we are seeing it more so in COVID. So that's something that I think the world is studying right now about how to manage the after effects.
Dr. Khan, I want to take you back to your childhood and ask you, why did you want to be a doctor? But let's take a short commercial break.
Sure.
Can get the program paid for.
Great.
Talk about that.
Great, wonderful.
Dr. Nadia Khan is our Woman in Focus today. Don't go away. We'll be right back. Welcome back. Our Woman in Focus today is Dr. Nadia Khan. So we talked about COVID, and I know we can talk about COVID for hours. Nobody would get. We still won't be scratching just the surface. Why did you want to be a doctor?
So I wanted to help people when I was young, and I think back to this story when I was really a little kid, maybe grade 1 or 2. I was watching this TV series called The Incredible Hulk. I don't know if you've ever seen that, but there was a scientist Bruce Banner, and he had this condition that he would turn into a green monster. And I, was fascinated by this, and I really wanted to help him.
Right.
And I used to think, how can I change him to he's a normal person and he doesn't turn into the Incredible Hulk. So right from a very young age, I was curious about how to solve problems, and that really stayed with me. And I think, I am a physician, I'm also a scientist
Right.
at UBC, and
Yes.
so I've always leaned into that, and I've always enjoyed it. And I would say that once I became a doctor, it was very in keeping with me. So my personality, I love talking with people and patients and trying to solve their problems and seeing if I can, and it can be very rewarding that way. And
So as a child, watching Hulk and growing up, where were you born?
I was born in Edmonton.
Edmonton.
Yes.
So you're Edmontonian.
Yes, that's right. That's right.
And your family, how many in the family?
I have 4 siblings in total, including myself, and they're all over the world. I have a brother in Australia, now a sister in Vancouver, and another sister in the US, so really all over the world.
And mom and dad?
My mother lives now here in Vancouver, and my father passed away.
Sorry to hear that. So were you, when your family came here, obviously with the name like Khan, did that have any negative impact on you while you were growing?
I think, we moved to Edmonton, and I think, in those days, in the early 60s, there were not many South Asians in Edmonton, hardly at all. And I think my father used to always say this story that, when he would go to the shopping center and you'd see another South Asian, they would run towards each other and say, come over for dinner. And so that's what it was like back then. So I think there was a really strong sense of community then.
Right.
And I think, though, that it's been challenging for all, I think, people of color, growing up in a community where you're a minority. I think that's always been a challenge. But I look at the fabric of North America today, and I see there's a lot more diversity than was present in those very early days. And so I think that things have improved a lot since then.
Growing up in Edmonton and with your education and then moving on to becoming a doctor, how much support did you get from your own family or your own community?
I would say I got everything from my family, and I have to attribute all my successes to my parents. And I think they just created a wonderful home environment. I think in the Khan family, they were always, interested in service and helping, and it's very much part of my, from my grandparents onwards, they were really interested in being a part of the solution. I think they've done a wonderful job.
And you would continue with that with your family? And
that's right. So for my children, I have 2 daughters, and they're now adults, and I always try to instill in them the same thing, that we are privileged to be here, to be healthy, to have a mind that works. And so I think with all of that kind of privilege, you have a responsibility to make the world a better place than when you found it. And I think, and so many people do. I'm always impressed by how many people are volunteering, they're working. And, as soon as I was done my residency positions, I started working at Hypertension Canada. And I've spent my whole life volunteering for the hypertension cause. And I think those kinds of things have been so meaningful to me. So I'm glad to be, I think it's very rewarding to contribute.
Now, with your background is South Asian.
Yes.
I want to talk about the South Asian community. We have our own predisposed conditions that no matter how hard we try, we're going to get heart disease, we're going to get diabetes, we're going to get arthritis, all that. So maybe we can talk a little bit about that.
Absolutely.
Dr. Nadia Khan is our Woman in Focus today. Don't go away. We'll be right back. Well, welcome back to Women in Focus. Dr. Nadia Khan is our Woman in Focus today. Looking at you, your beliefs, your life, what you've chosen, and I think you've got the best of your education, your spirituality, your religion, and working with people. You get to meet all kinds of people, different communities,
Yes.
different faiths, different religions. How do you practice in a myriad of different layers with your own beliefs? How do you compromise or work together?
Well, part of my research has been looking at how culture impacts healthcare. And, we were very interested in the South Asian culture and the East Asian culture, for example. And so we've been studying this for well over a decade. And so we know that culture impacts care, and we believe that culture impacts solutions of care. And so we actually started to do a clinical trial called the Namaste trial. And this was looking to see how culture actually impacts diabetes management.
Mm-hmm.
And so it was getting at some of these issues because we were noticing, we had done research and noticed that South Asians tended to be more fatalistic. So they would feel that their destiny was to get heart disease.
Right.
When it actually is not.
No.
And they would feel that, they didn't have to follow necessarily Western medications, or that Western medications were somehow harmful, and that food therapy, food as medicine, was the way to go. And this is very cultural. And then there's also really strong cultural beliefs in things like resting. So once people get to a certain age, there's an overwhelming belief, just rest, take it easy,
Yeah.
don't strain yourself,
Yeah.
don't. And so there's all of these cultural beliefs that are intertwined with health.
Right.
And so we were looking at those kinds of things, and we've actually just finished the study, but we're going to be looking at the results to see whether addressing those issues makes a difference. And I think when people think about South Asian culture and health, they think about causing higher heart disease, higher hypertension, higher diabetes. All of that is true, but there's a lot of strengths in the South Asian community that I don't think get as much attention as they should. So the fact that, South Asians have a very strong family bond, that's very protective. That's very helpful. And those are the kinds of things that we in our trial are looking to leverage to see if we can build on the success factors, the strengths of the South Asian community to help with health.
So this study, how far have you gone into it?
Well, we
10
have
years, you said?
We've enrolled about 530 people. We've finished enrolling patients
Okay.
into the
All
study.
right.
So we're now just about to analyze the data. So we started this study about 5 years ago in collaboration with the Fraser Health Authority. So
Right.
we've been working on this study. So I think we did see lots of interesting things about South Asian patients and how they respond to their health information, how they understand or don't understand. And I think if I was to say that the biggest misconception, I think, is around medications. And there is just this overwhelming thought that they're not good for you. And the general population also is very anti-medication.
You're right.
But there's a strong belief in the South Asian community. So when they're feeling well, they take a medication holiday.
Right.
If they have any symptoms, they stop their medication. So most South Asians will stop their medication for major disease conditions like diabetes, heart disease.
Really?
Most will.
Frustrating.
Well, it's. I wish that they would stay on them because all of these therapies are
Right.
proven to lengthen your life and prevent heart disease and things like that. So I think that some of these factors, these cultural factors, are playing a role into it, and it's challenging for how to manage some of those cultural factors.
But I do feel that, the South Asian community 40 years ago, 50 years ago, and the South Asian community today, totally different, because 40, 50 years ago, they would have to do a lot of work themselves,
Yes.
had to walk to work,
Yes.
take the transit, or maybe just walk. And now we don't do any of that.
That's right.
And I think people are finding in India as well that diabetes is growing like it's spreading everywhere.
Absolutely.
And people are not that active. So probably it's not being that active, that's one of the reasons why this community is caught in it.
Absolutely. And I think, if you look at India and you look here, factors like urbanization, so the move to cities. And with urbanization comes different foods, more calorie dense foods. It's not South Asian diet per se, it's the amount. It's the combination of the Western diet, fast foods, with the South Asian diet. It is the lack of physical activity.
Right.
And most of our, the way cities are built, you have to drive from A to B. If you want to go to Superstore, you've got to get in your car and go. You're not walking anymore.
No.
And what we're seeing that's actually really frightening, we did a study in British Columbia a few years ago. We wanted to see, is diabetes now impacting our children? Because when I first started studying this area, people said to me, Nadia, your data will not be worthwhile after a decade because everybody will have grown up here, they will have assimilated, they'll have adopted other lifestyles, and they will become healthier. And we actually saw the opposite of that. So now for the first time we see our youth, so South Asians between the ages of 5 and 29, the most common type of diabetes is now type 2 diabetes.
Wow.
And it's rampant, and it's starting very early.
Very early
If you're
age.
getting diabetes in your 20s, which is what we're seeing in the South Asian population, the problem is happening in your teens.
Wow.
So, when I started medical school, this is an example, it was in the news that there was kids that had type 2 diabetes. When they found a northern community that had type 2 diabetes, it was all over the news. There are 10 children that have type 2 diabetes and their children. And now it's the most common form of diabetes.
I think your work is going to continue in this particular field, and the community and us will benefit from it. And I think when your results come out, we would like you to come back into the studios and talk about it.
Absolutely.
Well, I'd like to take this opportunity and thank you very much for taking time out to talk to us.
Thank you. It's been my pleasure. Thank you so much.
Thank you, Nadia.
Thank you so much.
With that, we come to the end of our program, but don't go away. We'll be right back.